At present time, follicular lymphoma is usually considered as an incurable disease, although we do see patients that have a very prolonged survival or some patients that do experience very prolonged remission with new treatment. It's usually considered as a chronic disease which cannot be cured with the usual treatments. When we do consider a patient with follicular lymphoma over the lifetime, they may also encounter a particular accident, which is histological transformation, which is a transformation of follicular lymphoma into a much more aggressive lymphoma that may threaten their life in months or years. Follicular lymphoma is a lymphoma that is readily accessible to different treatments that usually can control the disease. The tools we have right now are more efficient drugs that allow a reduction of the tumor burden and to bring more patients into a complete response to first-line treatment or second-line treatment, which actually help to have the disease disappearing and controlling the disease for a prolonged period. The aim of maintenance therapy is to complete the efficacy of a first-line treatment or second-line treatment by prolonging the efficacy of the drugs that have been administered early on or using other drugs. The goal is to prevent usually relapses from the disease, then ultimately to improve the outcome of patients. We do know that follicular lymphoma patients after an efficient first-line therapy will ultimately relapse within 3 to 5 years. Therefore, there is a rationale of providing them with a maintenance treatment that may result in delaying further relapse. The benefit of rituximab maintenance in follicular lymphoma patients is that it does prolong the efficacy of a drug that has shown some activity to control the disease. It results in an increase of progression-free survival and in some circumstances in an increased overall survival for those patients. We do already have some evidence that rituximab maintenance is very efficient in second-line treatment. And there are a couple of studies that have indicated that rituximab maintenance can be used in the first-line treatment, that it's safe, it's well tolerated, and that patients may eventually benefit of this treatment. At the present time, every patient with follicular lymphoma that is in need for therapy does receive a combination of rituximab plus chemotherapy. What we are waiting as a result of the PRIMA study that will eventually provide evidence that a maintenance therapy after immunochemotherapy first line will prolong the progression-free survival and improve the outcome of those patients that will usually ultimately relapse. When patients do receive rituximab maintenance, a very small proportion of them do experience a progression or recurrence of their disease. For patients that relapse during rituximab maintenance, we may need other treatments in order to control the disease. But for those patients that relapse after the end of maintenance, we may be able to use again rituximab alone or in combination with other agents. When using rituximab as a treatment in maintenance, there have been a couple of early trials that use rituximab infusion every 3 months, while more recent studies have used rituximab every 2 months. We don't know yet which one is the better, but that's a regular administration of rituximab that is likely to provide the best benefit for patients. In most studies that use rituximab maintenance, a period of 2 years of maintenance has been used and tried. There are overall several studies that investigate a more prolonged maintenance period up to 5 years or until disease recurrence. Rituximab maintenance is associated with very few side effects. It has the ability to help controlling the disease and preventing an early recurrence of the disease. Patients that receive rituximab maintenance need to come to the hospital regularly to receive their infusion. There may be a small increased risk of infection for those patients, but which are common infections which can be treated regularly with adequate medications. Rituximab maintenance therapy is an easy, tolerable treatment. Patients' quality of life is preserved. They come to the hospital every 2 months to receive the infusion, but most of them can maintain a normal social, familial, and professional life during this period. Although rituximab maintenance is associated with increased costs due to the use of the drug, patients can maintain a normal life and have a delayed recurrence of their disease. Therefore, I think we don't have yet an evaluation of the cost-benefit ratio of maintenance, but it's likely to be favorable. At the present time, we do have evidence that using rituximab maintenance does provide a benefit for patients by delaying the risk of recurrence and providing a benefit in terms of disease control after a good induction treatment.